Open Targets has been going on for about 2 years now, and I think it has two essentially parallel and key components. So one of them is focused on integrating as much of the world's human genetic and genomic data as possible to try to bring into one place the key types of information and synthesize them so that scientists can use them to make really systematically informed decisions about targets. Our main area is at the Wellcome Genome campus in the UK, just south of Cambridge. And there, the Sanger Institute and the European Bioinformatics Institute, which are both cited there, I think bring very complementary expertise. So Sanger was a key player in the sequencing of the human genome and really brings a lot of experimental and human genetics expertise. And the European Bioinformatics Institute, the EBI, is really the world's hub for biodata in terms of storing it, curating it, and helping it to be used more widely. And I don't think there's any other place where in one physical location you can bring so many different threads together. I think we're open in two important ways. So the first is that all of the data, software, results of Open Targets are published and released for the entire world to use. And we think that's incredibly important because there are key areas of the early stage of understanding disease mechanism, what are the best targets to go after, and those are definitely best done collaboratively, working together between academia and industry, because any one company doesn't have the complete range, or indeed academic institute, the wide range of expertise and data that are needed to make these decisions. We're also open in the sense that Open Targets started as a collaboration between GSK, Sanger, and EBI, but we've evolved to include already one additional industry partner, Biogen, a biotech in Boston. And we are open to other partners who we think can bring new elements to let us achieve that strategic goal of transforming early target validation by allowing the systematic identification and prioritization of good targets. It's been a really rewarding and amazing experience for me to work in this initiative to bring real translational science to the Genome campus. I think all of us historically feel obligated in the last part of your grant to say, oh yeah, and we're going to do something and someday a drug company is going to make a drug about this. And that sounds good, but never actually happens. And it was one of the reasons that I was so interested in becoming involved in Open Targets, that this is a chance to really make that futuristic statement a reality. And the thing that has amazed me is nearly all of the academic faculty at Sanger and EBI have been fired up to get involved with Open Targets and to do projects that push their research that extra step in terms of translational potential. And I think it's even trickled down to the postdocs and PhD students. My own research lab at Sanger has had way more applications than I've ever had before because of people who see Open Targets as such a cool opportunity to do cutting-edge research, but to actually have the possibility to make a difference in developing new medicines. One of the things that would be a really amazing outcome for Open Targets would be to fundamentally change the gap between basic research science within academic institutions and its translation within companies, and to create both a place and a way of working where scientists from both sides would be permeating across that barrier and learning from each other and working together and picking up really exciting pieces of science and immediately taking them into drug discovery programs. And I think Open Targets has the potential to really do that because we've started bringing these two communities, which are often quite distinct, together. And so that's something I hope will make a big difference in.